This is Duncan Turner from the Vagina Doctor podcast. Welcome to the Consult With Me segment where we take a deeper look into our most frequently asked questions. But what do I know? I'm just a vagina doctor.
We have a lot of things changing in the office right now, but one of them is the frequency of the male callers coming through. And they're calling for a number of reasons, but right now it seems like an on-trend situation in the practice right now is erectile dysfunction. These guys are wonderful to talk to on the phone, usually a little embarrassed, but very humble. They're surprised to know of the different treatments we have going on. So let's get into that. What are we doing right now for ED?
Well, we've certainly seen an increase in the number of patients that call us about this. And I'm a gynecologist. That's my board certification. So I've been dealing with women most of my professional life. We've done lots of things to help women with sexual function, and sort of the men have been left behind a little bit.
Yeah.
And other than the various medications that you hear advertised on the radio and television. Cialis and Viagra. Yeah. Beyond that, patients don't really have a clue as to what to do. They also often may feel like their libido is diminished, and it's all a vicious circle, because when they can't perform, they're not as interested in trying to make things work and deal with the embarrassment of that, or they don't like the inconvenience of having to take a medication for things to work well. So, and lots of guys, a large percentage of men, more than 50% of men over the age of 40 could use some help. And it's a difficult thing for guys to talk about. Women talk about their sexual problems much more readily among themselves than guys do.
Yeah.
So,
what I've noticed too is a lot of these guys coming in, they've never had like a lab workup done where they've looked at maybe other reasons. What is your protocol in place for that patient coming through the door first time?
Yeah. Usually I'll have a conversation with them on the phone, and we'll then decide to do some lab work on them and have them fill out a survey of
what specifically on that labs are you looking at?
Hemoglobin, hematocrit, white count, and testosterone levels.
What about like heart health, or did one of those encompass that?
We look at those as well. So I do a really complete panel to and evaluate some vitamin levels as well, to see if there's some underlying cause, and perhaps the most frequent reason that can be determined by the history is what other medications are they on. They're on medications for anxiety, for depression, for high blood pressure. These can all have an adverse effect on the ability to get an erection. So we'll look at it from a wide perspective of issues. So the lab work is the first thing to be done. We also will do PSA, a prostate-specific antigen test, because we don't want to be treating somebody in a way that's going to make other more serious things more difficult. And so getting the lab work first and really talking to them and seeing what's the root of the issue. What is the problem? Is it really erectile dysfunction, or is it lack of libido?
Right, because you have testosterone therapy.
Right.
Which is for
libido.
For libido.
Yeah.
And then we have
lots of other things too.
Yeah.
So we have a lot of guys who are on testosterone therapy as well. And so looking at all of those things together. Now, in terms of treatment, there's some shockwave therapy, which, contrary to the way it sounds, is entirely painless. And that is a method of increasing the blood flow to the penis to remove the problems of erectile dysfunction. But it's a multifaceted treatment for this. We want to be sure their testosterone levels are good. We want to be sure they're not anemic. That we want to deal with other medications that we're on. And then if the shockwave therapy, often in conjunction with stem cells and exosomes, can be used to resolve the situation.
What type of physician should men be seeing to look at all this?
Well, the first direction they go into usually is to talk to their urologist or their primary care physician. There are specialists in male sexual medicine. They're called andrologists. So that's a good opinion to get as well. But the primary care physician will often just suggest one of the well-known medications, or in fact, you don't really even need to see your own primary doctor. You can go online and through telemedicine get a consultation and a prescription for those medications. The ideal patient for the shockwave therapy is actually one who has success using the medications like Cialis or Viagra, but they don't like the inconvenience or the side effects or the dangers of the side effects.
Right.
So those are things that could be obviated by using the shockwave therapy.
Great. So for most of the patients we have coming through for this, how successful are you at treating?
I would say that patients that absolutely cannot get an erection at all are really difficult patients to help with any of these methods. And it might be that psychotherapy is of value in those circumstances. I think we have all of the tools, whether it's psychotherapy or shockwave therapy or the medications or stopping other medications or changing other medications. All of these things together can be used. The treatments are very safe, and I just encourage people to investigate that, to research it, because so frequently it's just too difficult for patients to continue along the course of trying to do something about it without some real professional help.
Great. Thank you for unpacking this topic today. Thanks for listening. And if you have more questions, please let us know either by email or DM us on the Vagina Doctor podcast.
See you in the next episode. The Vagina Doctor podcast. It all starts here.